Bismillahirrahmanirrahim. Quote of the day. Who is the most favored of God? He from whom the greatest good comes to the creature. I am Dr. Muneeb Altaf, and today I am going to present the Ancova analysis under supervision of Prof.Dr Saira Afzal. So first we will see that what is the variance. The term variance refers to statistical measurement of the spread between numbers in a data set. More specifically, variance measure how far each number is the set from the mean. In particular, it measures the degree of dispersion of data around the sample mean. So analysis of variance, it's ANOVA. ANOVA test is a type of statistical test used to determine if there is a statistical significant difference between three or more independent groups by testing for the differences of mean using the variance. Now, what is confounder? A confounder variable is a factor other than the one being studied that is associated both with the disease or the dependent variable and with the factor being studied the independent variable. A confounding variable may distort or mask the effects of another variable on the disease in question. Now, what is a covariate? A continuous variable that exists naturally within a research unit and is not a part of main experimental manipulation but has effect on the dependent variable, leading to effect on the study outcome. So, for example, a hypothesis that coffee drinkers have more heart disease than non-coffee drinker may be influenced by another factor. The coffee drinker may smoke more cigarette than the non-coffee drinker. So, smoking is confounding variable in the study of association between coffee drinking and heart disease. The increase in heart disease may be due to smoking and not the coffee. So, in the same very example, if hypertension is considered, then the heart disease can be due to the chronic hypertension, as this hypertension if this hypertension is directly affecting the dependent variable but is not of primary interest, so this will be called as covariate. Now, ANCOVA. ANCOVA is an extension of ANOVA in which we would like to determine if there is statistical significance difference the statistical significant difference between three or more independent groups after accounting for one or more covariates. ANCOVA is also an extension of multiple regression. So, for example, a study was conducted in three different drugs, in which three different drugs were given to the three different groups, and life expectancy was considered the dependent variable. Applying all the assumptions, ANOVA will be used to check the statistical difference among their means. But if hypertension is considered as covariate variable, then ANCOVA test will be used because the hypertension can also affect life expectancy along with these drugs. As an extension of ANOVA. As an extension of ANOVA, ANCOVA can be used in two ways. To control for the covariates, typically continuous or variables on a particular scale that are not the main focus of your study, and to study the combination of categorical and continuous variable or the variables on the scale as a predictor. In this case, the covariate is a variable of interest as opposed to the one you want to control for. For example, in a study to test the effects of antihypertensive drugs on the systolic blood pressure in participants of varying age, the change in systolic blood pressure after treatment, which is a continuous variable, is the dependent variable, and the independent variable might be at age, which is a continuous variable, and the treatment will be a categoric variable. So within group variance, ANCOVA can explain within group variance. It takes the unexplained variance from the ANOVA test and tries to explain them with confounding variable or the other covariates. You can use multiple possible covariates. More you enter, the fewer degree of freedom you will have. Entering a weak covariate isn't a good idea, so it will reduce the statistical power. Ancova is an extension of linear regression. When used as an extension of multiple regression, Ancova can test all of the regression line to see which have different y-intercept as long as the slope for all the lines are equal. Like regression analysis, Ancova enables you to look at how an independent variable acts on the dependent variable. So Ancova removes any effect of covariates, which are the variables you don't want to study. Example, you might want to find out if a new drug works for the depression, and the study has three different uh, treatment groups and one control group. A regular ANOVA can tell you if the treatment works. ANCOVA can control for other factors that might influence the outcome. For example, family life and job status and drug use can affect the depression. So assumptions for the ANCOVA test. Firstly, the independent variable minimum of two should be of categorical variable, and dependent variable and covariate should be the continuous variable measured on an interval scale or ratio scale. Make sure observation are independent. In other words, don't put the people in more than one group. Assumption, normality, the dependent variable should be roughly normal for each of the category of the independent variable. Data should show homogeneity of variance. The covariate and dependent variable at each level of independent variable should be linearly related. Your data should be homoscedastic of y for each value of x, and the covariate and the independent variable should not interact. In other words, they should be homogeneity of regression slope. Application of the usage of Ancova. Ancova combine the principle of ANOVA with the principle of regression. A chief advantage of Ancova is that, in contrast to ANOVA, the independent variable can be of any data. In other words, one of its chief purpose is to eliminate the systematic bias. Suppose groups of patients have unequal number of swollen joint at the baseline, even though study may have been randomized. The initial number of swollen joint is used as covariate. So ANCOVA adjusts the post-treatment mean of the group to what they would have been if all groups have started out equally on the covariate. ANCOVA is to reduce the within group variance or error. Suppose a clinical trial investigates the effects on the ESR of a biological agent and an active comparator. Subjects are randomly assigned to achieve one or the other treatment, and the change in ESR is observed. Within each treatment group, there is considerable variation in ESR, reflecting the individual difference among patients in the degree of active inflammation. So ESR and active inflammation are co-varying. If one could statistically move this part of within group variable by allowing the degree of inflammation to be the covariate in the analysis, a smaller error term would result and the test would gain power. One-way ANCOVA. One-way ANCOVA is the extension of one-way ANOVA. In one-way ANOVA, you do not adjust the covariate, whereas in one-way ANCOVA, we adjust at least one covariate. The one-way ANCOVA test find out whether the independent variable still influence the dependent variable after the influence of covariates has been removed or adjusted. In this test, one continuous variable, one categorical independent variable, and at least one uh, continuous covariate for removing its effects or adjustment are used. Example, 20 patients of the diastolic blood pressure at 30 minutes are given. One-way Ancova test was used to compare the mean diastolic blood pressure in three age groups. After adjusting the effects of baseline diastolic blood pressure, which was found to be statistically significant, to the p-value was 0.02. As the Wien test for homogeneity was insignificant, and the resultant bone Ferroni test was used for the multiple comparison, which showed that the diastolic blood pressure was significant between one pair, which was the age group of less than 30 to more than 50, which having the p-value of 0.031, and insignificant between the rest of the two pairs, in which the age group less than 30 to 50 and 30 to 50 age to more than 50. So here the p-value was more than 0.05. One-way repeated Mayer Ancova. One-way repeated Mayer Ancova is the extension of one-way repeated Mayer ANOVA. In one-way repeated Mayer Ancova, we eliminates the effect of covariate or adjust the effect of covariate. The one-way repeated Mayer Ancova is used to test whether mean are still statistically equal or different after adjusting the effect of covariate. So here's the example of the female students, 15 female students who are having three different aesthetic techniques. And first we will have the current beauty score before the usage of technique, and then we will take the post-test score, which is the post-technique score. After applying the Ancova on the SPSS, we saw that the static technique usage have the p-value of 0.03155, and the current grade of the beauty was 0.73, which was nullified by the Ancova test. So p-value for the static technique is 0.031. Since this value is less than 0.05, we can reject the null hypothesis that each of the static technique leads to the same average beauty score, even after accounting for the student's current beauty grades. Recent advances, a new Sehon's approach in case of heterogeneity of the regression slope in Ancova, and it was published in 2018. In this study, when the assumption of linearity and homogeneity of the regression slope of conventional Ancova are not met, a new approach named as Sehon has been suggested to use conventional Ancova instead of robust or nonlinear Ancova. In this approach, we perform the conventional Ancova in each subgroup, which is constituted according to the knot value, and analysis of variance with the two-factor model after MARS model was used for the categorization of the covariate. So since this model with the interaction effect has more subjects, the power of the test also increases and the existing significant difference is revealed better. So we can say that linearity and the homogeneity of the regression slope are not problem for the data analysis by conventional linear Ancova model. By helping this approach, it can be used fast and efficiently for the presence of one or more covariates. So it's time for the MCQs. Question number 1. A researcher did a study on the COPD. After collecting the data and upon analysis, he came to know that there is a dispersion of data around the sample mean. Statistical measurement of this spread is called A variance, B covariance, C is the mean, D is the mode, and E is the median.
A.
Yes, A is the right answer.
Okay.
Variance is used to statistically measure the dispersion of test around the sample mean. Question number 2. A quasi-experimental study was conducted by Qasim. In this study, he observed a variable which is affecting both the dependent and independent variable, leading to affecting the outcome. What this variable will be called? A variate, a covariate, a confounder, a dependent variable, or the independent variable.
C. Confounder.
Yes, C is the right answer. Confounder, because it is affecting both dependent and independent variable, which is leading to affecting the outcomes. Question number 3. Ali is doing a non-randomized controlled trial about the effects of drug on the hypertension considering the age of the patients. Ancova test is used to analyze the data after applying all the assumptions. In this very case, age is considered as covariate variable, dependent variable, independent variable, nominal or ordinal variable.
A.
C. A.
Yes, A is the right answer. Age is considered as the covariate variable in this very scenario. Question number 4. A study was done in which different eye colored like blue, brown, and green groups, and the tendency of glaucoma is observed. In this sample, patient also gave family history of glaucoma. Which of the following tests will be used to measure the statistical difference of means of the groups? ANOVA test, T test, Ancova test, chi-square, and F test.
C.
Yes, C is the right answer, as the family history of glaucoma will be acting as a covariate. So to gain the power for the test, Ancova test will be used over here. A student did a study on the gender, male or female or trans, and the presence of diabetes, yes or no, with the age as a covariate. His supervisor told him that he cannot use the Ancova test. Why Ancova test cannot be used to analyze the data in this case? The independent variable is continuous, the dependent variable is categorical, the dependent variable is continuous, the covariate is continuous, and the independent variable is categorical.
C.
Yes, B is the right answer. The dependent variable, which is the presence of the diabetes, yes or no. So the dependent variable should be a continuous data to apply the Ancova test. Question number 6. To test the effects of antihypertensive drugs on the diastolic blood pressure in the participants of varying age, Ancova test will be used to analyze the data. Why an Ancova test will be used in this case? So to measure the standard deviation, to eliminate the effect of covariate, to enhance the effect of covariate, to measure the mean, and to measure the median.
C.
B. B.
B.
Yes, beta is the right answer. To eliminate the effect of covariate, and Goa test will be used in this case. Question number 7. A researcher did a study as was rejected in the board. But after eliminating the effects of covariate, his study got approved. How did the removal of covariate effects increases the worth of the study? By increasing the effect of covariate, by increasing the power of statistical test, by decreasing the power of statistical test, to change the dependent variable to categorical, and to change the independent variable to nominal.
B.
Yes,
B.
beta is the right answer. In the Ancova application of the Ancova test is the increasing the power of statistical test. Question number 8. A researcher did a study. In the study, the covariate was in continuous data. The observations in each group was independent. Data was not normally distributed. There was no extreme outlier in any group. And Ancova test cannot be used in this study because the covariate was in continuous data and the observation of each group was independent. The data was not normally distributed. D is the variables was homogeneous in each group and the covariate was in categorical data. Why Ancova test cannot be used in this study?
E.
C is the right answer. The data was not normally distributed. That's why Ancova test cannot be used. Question number 9. The Ancova test is an extension of ANOVA test. In Ancova test, the independent variable can be of any data. The main purpose of Ancova test is to eliminate the systematic bias, to increase the systematic bias, to eliminate the confounding, to increase the recall bias, and to decrease the recall bias.
A.
A is the right answer, to eliminate the systematic bias. Question number 10. To cope up the nonlinear regression, nonlinear and non-homogeneous relation with the dependent variable, a new approach is introduced. Which of the following is used with Ancova to measure the significant different mean? JN precision, peak point analysis, blocking and stratification, Sehorn's method, and Wilcox method. Delta is the right answer. In the recent updates, I mentioned the Sehorn's approach is used to cope up the non-linear and non-homogeneous relation. This is the key, and this is the YouTube link. Do like and subscribe, and thank you.
Thank you very much, Muneeb, Altaf. Very nice presentation. That is why I always admire your hard work. I can see the hard work that you have put in, especially your examples. They were very good. And I really liked your examples. Your 8 MCQs, all were scenario-based. However, your 2 last MCQs, they were not scenario-based. But I encourage this notion that you have used the recent advances in one of your MCQ. Very nice presentation, very well done, and keep it up. Allah
Thank
bless
you.
you. Allah Hafiz.
Thank you, madam.
Allah Hafiz.